and welcome to ENZYMENTAL. I'm Jason Carter, and today I wanted to talk to you about something that's often discussed among post-pregnancy or post-menopausal women, but very rarely discussed among men, and that is urinary incontinence. Urinary incontinence in men is not always an inevitable part of aging, but for those men who do experience UI, there are options aside from prescription drugs for dealing with this uncomfortable issue. Urinary incontinence is not a disease, but rather a symptom of another problem. The most common symptoms of urinary incontinence are changes or problems with urination, including a weak stream, urgency, leaking or dribbling, and more frequent urination, especially at nighttime. In men, urinary incontinence is typically caused by either nerve or prostate issues. Nerve problems arising from long-term diabetes, stroke, Parkinson's disease, multiple sclerosis, and spinal cord injury can often lead to urinary incontinence. Issues with the prostate, especially benign prostatic hyperplasia or BPH, may be the more common root cause of many causes of incontinence in men. The prostate's main function is to produce the fluid which carries sperm during ejaculation. The urethra passes through the prostate from the bladder, which is why abnormalities in the prostate can affect continence. Benign prostatic hyperplasia, or BPH, is the most common of these abnormalities. BPH is an increase in non-cancerous tissue growth that leads to an enlarged prostate, and it's common with age. As the prostate grows, it can squeeze the urethra and affect the flow of urine. While men in their 40s and 50s can certainly experience lower urinary tract symptoms from BPH, more than half of men in their 60s and up to 90% of men in their 70s and 80s have these lower urinary tract symptoms associated with BPH. In addition to BPH, certain prostate cancer treatments, including surgical removal of the prostate and radiation treatment, may also lead to urinary incontinence. As with any health issue, urinary incontinence can be positively influenced by diet and exercise. Regular exercisers often have far better muscle tone, which may promote better bladder control. In addition to maintaining a healthy weight, staying physically active, and adopting behavioral modifications, there are a number of supplements that maintain prostate health, which in turn can help to prevent lower urinary tract symptoms. Pygeum is an extract from the African prune tree, and it's been used in Europe to treat BPH since the 1960s. Studies have found Pygeum to significantly reduce urinary symptoms related to BPH, significantly a reduction in nighttime urination, an improvement in urinary flow, a decrease in residual bladder volume, and a decrease in daytime frequency. Lycopene is an antioxidant found in pink and red fruits like tomatoes, watermelon, and grapefruit, and has long been used to promote prostate health. Cranberry has a proven track record in preventing and treating urinary tract infections, and now research is proving that cranberry extract may be beneficial for improving urinary symptoms related to BPH. And also vitamin D is critical for proper muscle function, including those muscles on the pelvic floor. Vitamin D increases muscle strength and function, and a deficiency of vitamin D has been associated with a greater prevalence of urinary incontinence and other pelvic floor disorders. Although it isn't directly related to BPH, vitamin D may be an invaluable supplement in controlling incontinence through its ability to strengthen the pelvic floor muscles. So while urinary incontinence doesn't affect nearly as many men as women, when it does affect men, it's often related to prostate function. By adopting a few lifestyle changes and including a few beneficial supplements, you can easily regain control. But it's important to note here that lower urinary tract symptoms rarely, if ever, go away on their own. And these symptoms may be caused by more serious health issues, including, among other things, cancer or urinary tract infections. And this certainly confirms for me something that I've said to many guys over the years, which is that it's never too early to take care of your prostate. Thanks for watching. I'm Jason Carter, and I'll see you next time on ENZYMENTAL. Stay healthy.